Good morning, a pleasant day to all of you out there. Welcome to the program agenda, and thank you for watching us on Cignal TV, channels 8 and channel 250 for those with high definition television. And of course, you can continue to watch us on Facebook.com/OneNewsPH if you are somewhere outside the Philippines or have no access other than the internet. And of course, you can watch us also on YouTube, particularly our replays. Just enter One News PH and look for agenda. And you can also downplay the Cignal Play app. Thank you very much, PLDT, for the fiber optic internet service here in Lipa City. And today is July 8, 2021. 2021. It's a Thursday, and I do hope that you are all doing okay. Kasi mahirap na pong sabihin you are all doing great because the majority of Filipinos and the world are struggling with against COVID-19, struggling with the economic upheaval, struggling with various quarantine and health protocols. So anyway, we have lots to talk about today, but first let's go to the front page of the Philippine Star. Duterte, I'm sold to VP run. Or President Duterte is saying he's convinced about running for Vice President. Ano ba ito? Tunay na balita? O para mabalita? Okay, COVID testing back for vaccinated travelers. NCR vaccination to resume in mid-July. And on the bottom half of the Philippine Star, let's go. Rodi mulling another brand for second dose after Sinopharm. 10% of SMEs closed as of June, according to the DTI. K-12 review to streamline curriculum, says DepEd. Taal erupts anew. DOH, big possibility of another COVID wave. And let's go to the stories behind the front page. President Rodrigo Duterte says he is somehow sold to run for vice president in next year's elections. He also says the next president should be a friend of his, one whom he can work with so that he may not end up as inutil. And comment ko lang po dyan, it takes one to know one, or is he speaking out of experience? Because most of us know that is what happened to Vice President Leni Robredo, who became inutil because the president was not her BFF. Okay, pero as far as this vice presidential run of the current president, sorry, I'm a traditionalist. I believe in the spirit of the Constitution. Game over. Baka mangyari pa sa atin yung mga masamang nangyayari sa ibang bansa. Meanwhile, the Department of Health bears the possibility of another COVID-19 wave in the Philippines due to the threat of more transmissible variants. DOH Secretary Francisco Duque III thus says that The measures must be sustained to prevent further spread of the virus. Sorry to be commenting on the news at this point, but when an official of the DOH declared the Philippines as low risk, Secretary Duque did not scream bloody murder. Hindi siya nagmura, hindi siya nagpuputak. And then when it was pushed that we should allow people with who are fully vaccinated to travel based only on the vaccination card, he did not raise hell. Pero mukhang ngayong nagkakabistuhan na that, all of those declarations and pronouncements were somehow laying the ground para makapagyabang sa SONA, biglang nag-aatrasa na. I'm sorry, but yan po, sinabi naman po natin, when they declared vaccination cards will be used, I said, be careful ladies and gentlemen, check, kasi baka pagbiyahin nyo, biglang sumabit kayo. True enough, after that declaration the other day, there were travelers, a number of travelers who went to the airport to fly out of Metro Manila to their provinces who were prevented because as far as the airlines were concerned, hello, we don't know. Yun po. Anyway, moving forward, around 10% of micro, small, and medium enterprises or MSMEs have closed as of June due to the pandemic. 46% are partially operating, while 44% are still in full operation. This is according to the latest survey by the Department of Trade and Industry. Please pay particular attention to this development, ladies and gentlemen, because Team Agenda is trying to put together a show or an episode where we will tackle the nightmare of having lost your business and still needing to officially, formally close your business and incurring costs, whether you are a corporation, whether you are a single proprietorship, etc. May mga umiiyak po na nagsasabing, Kuyang, bankrupt na yung aming negosyo, kailangan pa naming mag-submit ng sobrang daming dokumento para sabihin na we are closed. So, contrary to popular belief, it is not a simple matter of locking the door and saying business closed or bankrupt, no longer in existence. Hindi po ganun kasimple. Ang dami pa palang mga rekisito, mga documents and filing at meron pang iba magbabayad ka pa sa kinaukulan. Okay. And the quote of the day, please pay attention to this one, lalo na kayong mga I am content, I am retiring, I am happy with my life. I have had that phase in my life and I realized that it doesn't make sense, at least in the plans of the good God Almighty. Chapter 9, it is from the book of 2 Corinthians in the Bible, chapter 9, verse 8. And God is able to bless you abundantly so that in all things, para sa lahat ng bagay, having all that you need, na nasa iyo lahat ng kailangan mo, you will abound in every good work. Ikaw ay uulad at maraming magagawang magandang gawain. Okay? Sabihin mo, Kuyang, nagiging pastor ka na ba? Hindi po, no? Kasi many of us, you've reached 65, you say, I'm retired, I don't need much in life, etc. Okay na ako dito, my children are already grown up and have moved on. Ladies and gentlemen, the blessings of the Lord is not sent to us para lang masarap ang buhay natin at masarap ang kain natin at masarap ang tulog natin. Baka marami sa inyo hindi masarap ang tulog kasi ginugulo ni Lord yung pagtulog. At sinasay, hello, kamot ka ng kamot ng tiyan dyan. I bless you so you can be a blessing to others. Okay? Whether you bless one person, hindi lang po ito pera, ha? Kami, modesty aside, pinatabi ko na po yung aking pagpakukumbaba at konting yabang na lang. We dedicated one room to, ilan ba sila? 5 girls, okay? Different ages. We gave them internet. Sige, para kaming public library. And they've been studying there. And I said, no one uses the room. We have no friends coming because of COVID. Let the kids use that as their study room. Hindi ko po anak ng security. Security guard ng lugar namin. Hindi ko security. Wala tayong security. Wala tayong kaaway. Anyway, this morning, I was rewarded. One of the girls showed us her report card for the year, dahil end of school year. Anak ng puro top of the charts, nanliit ako kasi ang tataas ng grado ng bata. And it just showed me that just by providing internet, a quiet place to stay, to read, to study, and to rest, can really motivate people, young people, to become performers. So, yun po. Anyway, nako, baka kuya, tama na. Kagalit na yung aking EP. Okay. Let's go to the interview portions of the program. Senator Amy Marcos has claimed that Philippine Health Insurance Corporation, or PhilHealth, has accumulated 26 billion pesos in debts to hospitals. Our own sources also confirmed that they are reeling from unpaid PhilHealth claims. Some are even forced na mangutang or to take out loans, and some have actually sold out. Marami po na akong kwentong napipick up na pag pumasok ka raw sa hospital ngayon, medyo wag ka nang umasang ang daming nurse at saka magaganda at mababait yung nurse. Yung ibang hospital, oo. Pero karamihan daw po, medyo mainit din na ulo ng mga nurse kasi ilan na lang sila per floor. Tapos ang mga duties pa nila, kumisan umabot ng extended hours dahil talagang napakakonti ng mga nurses, walang pondo, konti na pumapasok sa hospital. So anyway, in the long of time, sa haba ng panahon, matagal na natin pinipilit makakuha ng makakausap sa PhilHealth, our last attempt, sumablay pa yung internet. Let's hope today that we have a better opportunity to clarify matters para naman fair sa PhilHealth. We have with us Dr. Shirley Domingo, spokesperson for PhilHealth. Doctora, good morning.
Hi, good morning, Cito, and good morning, everyone who's listening and watching your program today.
I pray to the Lord maganda yung connection. Sana maganda yung internet.
Sayang na last time we talked, na-cut kami because I was at home and the signal was not too good. Pero okay naman. I'm in office now, just to be sure.
Okay.
I came here at 6:30 in the morning just for this.
Okay. Sorry to impose, no? Pero kasi Dr. Domingo, medyo, allow me to call you Gigi. Matagal na tayong kaibigan. Alam niyo po, mga kaibigan, itong si Dr. Gigi, she is one of the most helpful people I've known in PhilHealth. Sa dami ng mga naging administration na nagdaan dyan, na nananatili siya dyan, tapat sa trabaho, and nakikita naman natin na maayos naman dyan Kanya lang, laging napopolitika ang PhilHealth, so nagkakaroon ng maraming aberya. So anyway, Doc Gigi, I'm sure you've read my column in the Philippine Star, and kasi alam mo naman tayo, sumbungan kuyang, sumbungan ng bayan. Ano ba ang reaction ninyo? What is the reaction of the PhilHealth? First, on that statement of Senator Amy Marcos that there are 26 billion pesos worth of unpaid claims. And di ba nag-declare ang PhilHealth na nagbayad kayo ng 8 billion recently?
Yes, yung reaction namin dyan, first of all, there should be reconciliation of the actual amount na utang ng PhilHealth. It's not really utang because at any time, may process na PhilHealth claims. So at any time, may claims na nasa office namin. So we want to reconcile the figures that the hospitals are giving us and our figures. And our regions talaga, ginagawa na yan sa regional offices namin. Nakikipag-reconcile sila, nakikipag-meeting sila sa mga hospitals to determine the real amount that we still have to pay the hospitals. Kasi alam mo Cito kasi, there's such a thing as a return to hospitals. There are some claims na binabalik sa hospitals because of whatever reason, documentary requirements, may kakulangan sa mga na-attach nila, no? So binabalik namin yan sa hospital and within 60 days, they can refile that claim with us. There are some claims that are denied, no? And ang nangyayari, the hospital puts all of these claims, RTH and denied, in their payables of PhilHealth. Habang kami naman, hindi namin sinasama yan because when it's returned to the hospital, then it's up to the hospital to file it with us. Therefore, it's not payable. It's something that we return to them. Kaya kami nag-iiba ng figures. So that's the first step. We are reconciling with them. That's ongoing with our regions now. We're reconciling figures with them.
Okay, now, wala ka bang earphone dyan? Anyway, I'll let Gabby take care of that problem. But in any case, here's the situation, Doc Gigi. No? May mga iba-ibang sumbong sa akin. Ang first na sumbong, as I wrote in my column, is that because the PhilHealth understandably has to change policies as they go forward dealing with these new problems with COVID-19, ang nangyari, nagkakagulo-gulo yung mga claims or collectibles or expenses. For example, I think in 2020, PhilHealth said, basta healthcare workers covered yan, basta COVID-19 fully covered na yan. And everybody was happy and admiring PhilHealth for that statement. Until PhilHealth discovered na per case yata umaabot yung mga claims na average of 1 million plus or 1.3 if I remember in the news. No? And so the PhilHealth administration in 2020 said, teka, if we keep doing this, we're going to run out of money. So you guys formulated a case rate for COVID-19. And then, ang nangyari, the following year, sandali, back to square one tayo, covered pa rin ang mga healthcare workers, hindi case rate, fully covered pa rin, etc. And then, so, parang there were claims or patients who were caught in between. So, ang sabi ng mga hospital owners, okay yung ginawa ng PhilHealth, paano yung naipit sa pagitan, yung caught in the middle, so to speak? How do you resolve that? And then, another complaint related to that is, they always get a verbal notice, a informal notice, pero nakakalimutan yung formalization of notices. Kunyari, nagbago ang case rate or nagbago ang coverage kasi meron yatang particular case where it was said by PhilHealth, we will only pay claims for COVID patients who test positive. Pero ang problema raw ng mga hospital, paano naman yan, Cito? Pag pumunta sa amin, the presumption is they're all probable COVID until the tests come out. But last 2020, the test took something like 10 days to come up with the results because pinapadala pa sa Manila, pinapadala kung saang regional laboratory. And what would happen is in those 10 days, they were treating patients like COVID patients, spending time, money, effort, etc. Tapos pagdating nung memo ng PhilHealth, teka, negative pala yan. So, hindi namin babayaran yung mga ibang procedure na ginawa ninyo dyan. Pasensya ka na, Doc Gigi, haba nung aking pasakali.
Okay, so punta tayo doon sa first na mention nyo, no? And this is that tawag namin ng full financial protection. In other words, we pay the whole amount, no? What happened was, how you narrated it, it was like that. But the reasons behind that, iba, no? When the pandemic came to the Philippines, mga February yata yun, no? Later part of February na tayong napasukan ng COVID. We had 2-3 cases, no? At that time, nothing was clear yet about the COVID science, the science of COVID. No, nothing was very clear, and therefore we had to respond and pay hospitalizations due to COVID. No, the usual kasi na ginagawa natin is that when we come out with a package rate, we look at clinical practice guidelines para maka-come up kami ng cost of that condition, that medical condition. So, wala tayong clinical practice guidelines kasi bago yung COVID. Wala tayong alam. We cannot come out with a reasonable cost for inpatient claims or benefits kasi wala pa tayong gagayahin na clinical guidelines, clinical guidelines. Hindi natin alam yun eh. So, what we did was to respond to the times at that particular time was to say, okay, we'll pay for everything. So we will pay for everything. But we gave a deadline that was April 15. I think that was April 15. And for me, that was reasonable because wala pa kami alam. We cannot set a price for our inpatient benefit. So we paid for everything. And then, but yun naman, this is not sustainable. It will really eat up our funds. Lalo na at that time because cost of medications, lalo na yung critical cases, the cost of medical care, umabot yan ng mga millions, several millions, no? So hindi sustainable yung ganyan arrangement. So as data came in, then we were able to cost already and for a benefit for inpatient package. So that was the first benefit inpatient package that we came out with, and therefore we announced that April 5th, paying the whole medical bill will end April 15. After that, we implemented already a package rate for the types of cases: mild, moderate, severe, and critical. So that's what happened. Now, as to healthcare workers, ano yun part yun ng law that we have to take care of healthcare workers, yung bayanihan Heal as One, which took effect around March, and it was ongoing for 3 months, the March, April, May, so around May, no? And the second law came out around September. That was bayanihan to recover as one. And in both those laws, nandun na we have to take care of the healthcare workers. Therefore, dapat full payment talaga when they get sick. So that was our policy. We adopted that policy. Healthcare workers, we pay in full for that, for their hospitalization needs. We had to come out with an advisory sometime November last year, later part of last year, that we will still continue paying for healthcare workers, because if you look at the wordings in the first law, it says that during the duration of the national emergency. Maybe at that time, nobody knew how long was the national emergency. Maybe nobody knew that it will take more than a year for national emergency, because the law ended after 3 months, right? And so, tuloy-tuloy yun, because tuloy-tuloy ang national emergency. So we had to clarify na tuloy-tuloy yung assistance natin sa healthcare workers during the duration of this national emergency and until we can review our policies. So, ganun ang nangyari. Yes. So, ganun nangyari po sa full
But what
protection.
happens now? What happens to all the, all those cases that were caught in between? Kasi tama naman yung sa PhilHealth, you cannot operate beyond the purview of the law or outside the law. Dapat may batayan yung paggastos ninyo. Pero yung hospital naman, ito yung dilemma kasi ng hospital from how I understood it. Darating yung mga pasyente. You have patients coming in and you cannot be choosy, you cannot be selective, you cannot, in fact, when I got hospitalized recently, you're aware of that, they wouldn't let me in until I was RT-PCR tested. So maraming protocol na kailangan sundin yung hospital, kailangan gawin mga test, etc. at saka paggamot. And pag biglang lumabas na, teka, negative naman yan, hindi naman COVID yan, parang who's going to pay for whatever procedure was done but is not covered by the case because hindi pala positive sa COVID. Kasi parang presumption COVID di ba? And then lumabas hindi COVID. Ang iniiyak ng mga hospital, paano na kami? Ginagawa lang namin trabaho. Pag hindi namin ginawa yung trabaho namin, kayong mga tiga-media, pinagbubugbog nyo kami sa telebisyon.
Yes, totoo po yan. At the start of COVID, last year, we were paying even for as long as it's a probable case. Kasi last year, may classifications yan, probable case, di ba? May ano pa nga a person under monitoring, person under investigation. Mga ganyan yung mga earlier classifications of COVID cases. So we were paying for probable cases. I think the confusion na nakarating siguro sa iyo would be that circular that came out recently saying that we will not pay we will not use the inpatient benefit COVID claims benefits amount for RT-PCR negative starting November 26. So November 26. But prior to that, we will still pay. So starting November 26, we will pay only using the COVID benefit amount for RT-PCR positive. And tama naman yun because early 2020, even our testing centers and the results, there were problems with that. Konting-konting testing centers. Later on, dumami na. End of the year, dumami na. Ngayon, marami na. Di ba? So, tama lang that end of the year, mga November 26, that was when we started saying, that is the start of date when we will pay only RT-PCR positive. So, ganon. Ngayon, sabi ng hospital, paano yung na-treat na as COVID? Kasi, if they are RT-PCR positive negative, may matatanggap pa sila, definitely smaller than our COVID inpatient benefits. No, we call it the intermediate package, and this will be depending on the severity again, 18,000 or 36,000 for cases pag RT-PCR negative. So yun, sabi ng hospitals, bakit paano naman yung mga yung mga na-treat na nila as COVID positive COVID cases pero negative sila. We advise them, it's even in our circular, that they can still file for appeal or MR dun sa ano nila. There's still a venue for them to file an appeal dun sa atin.
Okay.
Sa cases natin.
Yeah, Doc Gigi, let's go for a quick break, and when we return, pag-usapan nga natin yan na paano yung na-treat na as a COVID positive pero naging negative, because I understand parang ang remedyo is you put them under pneumonia case rate. Parang yun na lang yung paraan para makabawi yung hospital kaysa sa magkalugi-lugi. We'll go for a quick break and we'll ask for your clarification also on the matter of how the PhilHealth is paying for extreme COVID. Kasi dyan nagsimula yung aking pangungulit sa PhilHealth na makahanap na makakausap kasi may mga patients daw na extreme COVID na ayaw pang i-classify at namumroblema rin yung mga pasyente na who were under the impression na zero balance o no balance billing pero biglang 700 something na lang ang cover ay yung mga hospital bills 1.6, 1.8 million. We'll go for a quick break. We'll be right back here on Agenda. Okay, welcome back to the program agenda. I'm your host, Cito Beltran. You are watching us via Cignal TV, channels 8 and 250. And let's go back to our guest, the spokesperson for the PhilHealth, Dr. Gigi Domingo. Dr. Domingo, welcome back.
Thank you.
Okay, Doc Gigi, bago ako mapagalitan dito kasi may mga pumapasok na questions, pasasagot ko muna sa iyo kaagad. It has been reported that PhilHealth is studying to expand its coverage on COVID cases. What will the wider coverage include and when will it be implemented?
Yes, that's true. We're studying a new case rate for COVID inpatient cases. Pareho pa rin because we pay case rate. So the medications, pareho pa rin. No? It will answer the whole cost of treatment of COVID. But the amount will be different. And mahirap sabihin muna yan because it still has to be approved. But the study is ongoing and experts are looking at the amount before we process and finalize it.
Are those experts doing a survey? Excuse me. Are those experts doing a analysis, survey, or sampling of the average cost of COVID treatment? Kasi yun yung pinatutunguhan ko kanina, that at least 2, if not 3 cases that approached me, involved patients who spent 1.6, one spent 5 million, the other spent 2 million in extreme COVID, ICU, etc., etc. And then yung case rate daw only allowed for 780 something or like that. Sabi nung mga yon, akala ba namin covered ng PhilHealth, no balance billing. Ngayon, zero balance na yung bangko namin, magbebenta pa kami ng bahay at kotse. What's your response to that, Doc Gigi?
Yes, there are different, there's a variety of ways to manage COVID. And the hospitals, the doctors themselves, it depends on their judgment at the time, what to give medications, what else to do about the patient. No? So iba-iba yon. And therefore, the cost of treatment of a COVID case ay iba-iba sa hospitals, sa doctors, iba-iba yon. So what PhilHealth does is, we also look at market prices, but what we really do is to base our case rates on clinical pathway guidelines, yung accepted guidelines to treat case. So we need experts on that. That's when we consult our experts on how best to manage a case. For this instance, a COVID case. So how best to manage it? What are the procedures that has to be followed? Kasi marami yan maraming maraming variation in managing the case. So that's what we do. We follow clinical pathway guidelines accepted by experts.
That's valid, clinical pathway. Pero para maintindihan ng ating listeners, yung batayan ba, is the cost factor determined based on public hospital or private hospital? I'm being specific here because clearly the pricing in public hospital and in private are two different galaxies. And baka mamaya yung public hospital ay yun ang batayan. So of course, the case rates will never cover what's going on in the private hospital.
Yes, as I said, a market assessment is done whether public or private. So we look at all the cost and we look at the basic cost kasi nakikita rin naman natin yun when we study that. That's why we bring in experts to help us do cost analysis of these cases and looking at the accepted clinical practice guidelines.
Okay, just so that PhilHealth can answer, Senator Amy claimed that PhilHealth owes 26 billion to private hospitals. How true is this? And what is the possibility na kung ganyan na kalaki ang utang ninyo, baka wala na kayong capacity to pay?
Okay, as I said earlier, we are reconciling figures, and in fact, some of the results of this reconciliation activity shows that the hospital is claiming this much amount, but it's really lower than that because they, as I said, they included return to hospital claims and denied claims, which shouldn't be. And therefore, we're reconciling. That's ongoing in our regions, uh, and uh, and with that, we're fast tracking the payment of claims. No, several reasons why claims payment are not yet. Are not yet on time, and one of that is because of some policy that we had to resolve in relation to COVID.
Okay.
But anyway, all of this was already being addressed, and we hope that claims will be faster in processing.
Okay.
Aside from the fact, okay, aside from
Uh,
the fact,
Go ahead, go
sorry,
ahead, go ahead.
okay, aside from the fact that natamaan rin naman ang PhilHealth, yung office namin ng COVID na pandemic na ito. There are lots of people who got COVID, quarantine, isolation, people working from home. So that also caused the mas mahabang processing of claims.
Okay. Doc Gigi, may tanong dito. Baka hindi ko masyadong maintindihan to. No? Please ask and clarify no balance billing for COVID. Iba-iba interpretation. Wala na admit sa ward, puro private room and ICU. So, I don't know. Kasi meron pa ako na pick up na yung sinulat ko sa Philippine Star, yung take or pray, meron pa raw isang approach yung PhilHealth. I don't know how accurate the report is to me, that there is a counter offer from PhilHealth that if a private hospital has a whole bundle of claims, o sige, we'll pay your claim, 60% of your claim para wala nang mahabang usapan, para tapos na, and it is parang a strategy para ma-whittle or maalis yung probability of over pricing or false claims. So 60% pag tinanggap ng private hospital, no questions asked na. Pero meron daw isang tumanggap, hindi raw 60% ang nakuha, installment pa ang nakuha. Can you respond to that, Doc Gigi?
That's called the DCPM, or the credit payment method. And this is a type of claims processing offered to hospitals in IATF identified highly critical areas with because of COVID. So what happens there is that in order for us to provide at once financial resources to this hospital, ibibigyan namin sila ng 60% of the good in-process claims or claims na nasa amin na, then we will release 60% of that. They have to give us requirements. One of that is a letter of undertaking that they have to sign and give it to us. No? And the reason for that is para makapag-provide kami kaagad ng pera dun sa kanilang sa hospitals, no? Para fluid kaagad sila. So, ang 60% na ito, it doesn't mean na hindi na namin iproprocess. Hindi, that's not the way it works. We will still process all their claims. No? And then, doon sa remaining 40%, doon tayo magre-reconcile ng figures. For example, there were some claims na disallowed pala, denied pala. No? So, makukuha yan sa 40%. So, we will release the 40% upon reconciliation of their claims. So,
Meron ba kayong, kasi meron tayong anti-red tape law. Meron tayong 7-14-21 Declaration of the President. Yan bang mga claims na yan, whatever happens, PhilHealth can really process at the most in 21 days? Kasi sabi mo kanina, up to 60 days. Baka maging issue yan. And you know me, I've always been supportive of PhilHealth, but I also have to...
They're signed the documents and all, then we process good claims within the 60 days. Right now, we have a turnaround time of 43 days on the average. Iba-iba yan per region. But these are good claims. There are some claims that we refer to legal, then it will be more than 60 days kasi referred to legal siya. There are some claims na binalik namin sa hospital. And in fact, that's the reason why they said na hindi naman 60% ang binigay namin. Because they were expecting another amount doon sa computed namin. They were expecting na siguro kahit yung return to hospital and denied, payable sa kanila yon. Sa amin, hindi yan payable. So we stick to the 60% of good claims that are with us. So
Okay.
magkaiba the reason there's difference.
Okay, thank you very much, Doc Gigi. At least nagkakaliwanagan kahit papano, and we will definitely be calling on you more para maliwanagan pa itong ibang to, kasi I don't think this is going to be the last discussion on the matter. But nonetheless, thank you for giving us your time, and pakisabi sa mga kasama mo, hindi naman ako nangangagat, ano? Magpa-interview rin, lalo na yung presidente ninyo. Thank you very much, Doc Gigi.
Spokesperson di ba?
Yeah.
I'm always available.
Okay, pero alam mo na, iba rin na rin makita yung the leadership in front of the camera. Thank you very much, Doc Gigi.
Thank you also for inviting me. Bye and have a good day. Bye.
Okay, that's Dr. Gigi Domingo, spokesperson of the PhilHealth. And yung pong huling hirit ko na yun, it's just, to encourage leaders of institutions, magpakita kayo, magparamdam kayo, kasi hindi naman lahat po kalaban. Kami, yung iba sa amin kakampi. Pero siyempre kasi yung credibility ba, when the boss talks, everybody listens. Okay, speaking of boss, eto, isang boss to. Herbosa. Dr. Ted Herbosa, Special Advisor, National Task Force Against COVID-19. Welcome to the program, Doc.
Okay yun, Cito. Good morning, Cito. Nice to be back. No? Okay yun, Herbosa. Advisor lang po. Advisor lang po. That means kung papakinggan ng boss, okay. Kung hindi, they make the final decision. They're the policy maker.
Well, thank you for joining us, and it's been a while, been wanting to speak to you, pero mukhang na-busy ka, and I just want to catch up with you, particularly with what's been happening, kasi I'm very concerned about what's happening in Indonesia, and baka sabihin ng mga nanonood, ano ba pakialam mo sa Indonesia? Yung Indonesia, isang sibid, isang kumpit, nasa Indonesia ka na, and vice versa, nasa Pilipinas ka na. And I'm worried that the Delta variant that is so widespread in Indonesia may come into the Philippines. Ngayon, kahapon, kausap ko si Doc Tony Leachon, kaibigan natin, and he was saying na we really need to do more testing, particularly in southern Philippines, to find out ano ba yung kumakalat doon. Kasi unfair din naman to places like Jensan, CDO, or particularly Negros and Davao City, na parang napopolitika na sila. Kayo, ang sama ng COVID cases ninyo, without realizing na baka may Delta variant na doon from southern Philippines.
Well, Cito, bago natin takutin yung ating mga kababayan about...
Hindi ako nananakot.
Good news muna.
Sige.
The good news is this morning, we have exceeded 12 million doses of vaccination. 9 million ang partial protection or one dose, at 3 million ang fully protected. So ang ganda, no? 3 million Filipinos now have 2 doses. Now, punta tayo dun sa variants, no? Yung knowledge ngayon natin na pag may 2 doses ka, you are protected from the Delta variant. Yan ang sinasabi ng ating friends from the National Health Service sa UK. Very important to get your second dose.
Okay.
Yung situation natin sa Philippines, siguro, we have to explain the process of biosurveillance. Dapat maintindihan ng ating mga kababayan na hindi ang variants ma-identify mo lang by doing the full genome sequencing. Mahal pong test yon. This is done by the Philippine Genome Center. Ang tawag namin dyan is biosurveillance.
How much is mahal?
Like for example, yung about 36 samples will cost you 3 million in one run. So right now, yung biosurveillance natin, ang nagpupondo dan is the Department of Health. Ang gumagawa niyan ay yung UP Philippine Genome Center. At ang total na sample na natin, na full genome sequence na natin, no, with the data, is a little over 7,000. Yan lang yung number of cases natin a day. If you really think about it, di ba? Between 4,000 to 6,000 a day. So we are sampling a very small percentage. I think nasa 1% lang of all the positive samples. May mga bansa.
But are we doing targeted sampling in southern Philippines, particularly in Davao?
So we are doing targeted sampling for number one, the OFWs, and we have picked up 19. 19 na Cito ang na-pick up nating Delta variant, but they were all infected outside the country.
Yeah.
So nung pagdating nila, quarantine procedure, 7 days PCR test, swab, tapos yung sample na yun pinadala sa Genome Center at yun yung nag-positive. Of the 19, isa po ang namatay.
Yeah, but
So
what about Doc Ted, what about Davao? Alam mo, mahal ko yung Davao
Second are hotspots. So yung hotspots like Zamboanga, Davao, Cagayan de Oro, nagpapadala din yan ng sample sa Philippine Genome Center. The one that decides which places get sampled is the Epidemiology and Surveillance Unit, the Epidemiology Bureau ng Department of Health. So kinakuha nila ng certain samples, parang random sampling. Parang yung ginagawa ng mga survey sa politiko, di ba? Kung sino mananalong senator o presidente, random sample nila yung hotspots at based on that, ipo-project. So as of now, wala pang nakita ang Philippine Genome Center ng Delta variant sa community sample. So I'm safe to say, I'm not safe to say, the evidence does not show any Delta variant in our community. So hindi pa natin siya nakita. Kung nandyan na siya, hindi pa siya na-sample ng biosurveillance. Ang truth and in fact sa science is 90 na yata yung countries all over the world that has the Delta variant. And the WHO ay takot dito, like you, and like many others like us, takot dito sa Delta variant because ito daw yung magiging predominant variant nitong COVID-19.
Well, not only because it's going to be the predominant variant. Kanina sabi mo kasi bago ko takutin yung mga Pilipino, hindi po ako nananakot. Pero kung mapanood ng mga kababayan natin, Doc Ted, and I know you watch this, you monitor this, when India got hit by the Delta variant, they were burying out in the streets. Ngayon sa Indonesia, nagkaubusan na sila ng oxygen. And gano'n na rin, naglilibing na ng maramihan. And I don't want to see that in the Philippines. God help us if that happens in the Philippines. So, mabutihin ko lang sabihin yung nananakot ako kesa sa magbabaon tayo ng libu-libong Pilipino, lalo na sa Southern Philippines. Now, having said that, kasi sabi ni Dr. Ana Lim Ong, I hope I said it right, no? Kahapon.
Ana Ong Lim.
Ana Ong Lim. Sabi ko na nga ba, baliktad na naman yung aking utak eh. Yung sinabi niya na yung nangyaring surge last April was like a dress rehearsal. Now, a dress rehearsal is different from having an on-the-ground contingency plan in case the Delta variant comes into the Philippines and spreads through the community. Are we at least monitoring our supply chain in terms of oxygen and how we can fight this Delta variant if it happens? Kasi ayoko mangyari yun, nangyari in the past eh. Kung kailan sumapol sa atin, parang doon pa tayo naghahabol. Not blaming anybody, no politics, but I think you yourself would agree that sooner or later that thing is going to come here one way or another.
So that's the good news, no? That's the second part of the good news that I would like to say is Secretary Galvez has put us together to come up with together with the USEC Sid Purisima to come up with the contingency plan to prepare for the eventuality of so we are now putting together exactly what you described. Number one, we're looking at the inventory of our stockpile of PPE, oxygen, medicines, testing kits. So, yan yung mga pwedeng maubos, no, as you enter a Delta variant situation. Tapos we're also looking at the quarantine facilities. Alin yung mga nagsara na we will have to reopen once mapasok tayo. So tama si Dr. Ana Onglim, she's an infectious disease specialist. Pinasok tayo nung South African variant yon at UK variant. So that's an exercise in variants entering our country. Naalala mo, August, September, October, November, December, February, okay tayo. Until the South African variant came into Pasay yata, no?
Yeah.
And then it spread all over Metro Manila. And we came to a point in mid-April na may mga namamatay sa tent outside ng ER, may namamatay sa ambulansya, may namamatay sa bahay dahil hindi ma-admit sa ICU. At that time, ang statistics natin, 88% ang occupancy rate ng ICU. That means, sa amin, sa medical field, if it's above 85%, wala kang reserve to admit the new cases.
Ubus na.
That means,
Doc Ted, let's go for a very quick break, and when we return, let's talk about all this and also the new health protocols and where do you stand as far as this COVID pass? Kasi to be honest, sa akin, pasalamat kung pwede na yung vaccination card as COVID pass, but having spoken to various medical experts, parang, ganansya ko, perwisyo naman sa iba. So we'll go for a quick break, and when we return, let's tackle all of that quickly here on Agenda.
Okay.
Okay, welcome back to the program Agenda. I'm your host, Cito Beltran, and joining us once again, Dr. Ted Herbosa, Advisor to the National Task Force Against COVID-19. So, the last good news you shared is that a team of experts are already have been put together to come up with a contingency plan in the case the COVID variant comes into the Philippines, itong Delta variant. Now, meron daw revision of protocols according to Secretary Duque, to the DOH or IATF. Ano ba itong latest protocol na ginagawa?
Okay, so if you recall, last Sunday, nag-issue si Secretary Harry Roque ng IATF resolution na pwede nang gamitin yung vaccination card for interzonal travel. That is, so medyo nagkagulo doon. Some people don't understand interzonal travel. And then itong League of Governors at saka itong mga local chief executives, yung ULAP, ay nakiusap na they still want to pursue some sort of testing. So nag-issue uli kahapon ang IATF, ang DOH at IATF ng new resolution, again asking that kung magte-testing, ang i-remind sila ang gagamitin ay PCR testing at hindi nire-recommend ang antigen testing as some sort of border control. So today, I think at this afternoon, magkakaroon uli ng IATF meeting. I think kasama doon yung LPP at saka yung ULAP officials para pag-usapan ito, no? So they want to iron this out. Medyo nagkaroon tayo ng confusion. Sabi nga ang impression dito is atras abante. So what happened is it might create some confusion sa implementation on the ground. Baka ang nabasa nung police sa border control yung unang resolution, pero yung nabasa naman ng kabila itong later na kailangan mag-test. So baka magka-debate. So ayusin yan. They've come up with a statement na hino-hold muna yung unang issuance na ang tawag dito, gagamitin yung vaccine card. Pero alam ko may mga proponents tayo that still want to use the vaccination card. And I think that's science-based, no? Kasi pag fully vaccinated ka, maliit ang chance na mag-transmit ka. Pwede kang mag-transmit, pero mas maliit ang chance mo mag-transmit. And I'd like to reserve the test kits ng PCR for our Delta variant intrusion, di ba? Kasi kung unnecessary yung testing at pang border control lang, that's an expensive model, no? Yung asymptomatics kasi 3% lang. So, yung may lagnat, may simptomas, madali yun eh. Kung may lagnat ka, may simptomas ka, ay huwag ka magbiyahe. Sa bahay ka lang. So, ang hinahanap mo is actually the asymptomatic. And if you look at the data, only 3.8% are asymptomatics of all those that were tested. So, ibig sabihin nun, magte-test ka ng 100 PCR para humanap ng 4 na taong positive. Parang sa cost-benefit analysis, parang overkill, di ba? Yun ang mga ano dyan, yan ang science. That's the way I look at it as a scientist, na parang sobra naman yan. But from a politician's point of view naman, a local chief executive, teka muna, isa lang makapasok dyan at magkalat ng sakit sa aking community, hindi maganda yung health system ko. My health system is not as nice as NCR. Mahihirapan ako. Ako rin ang tutulungan nyo kasi sasabog yan, dadami ang isang case na yan. At, so, walang mali, walang tama. Both have, it's like an honest debate wherein people need to really sit down, talk it out, and I'm glad may meeting mamaya. Siguro hindi naman sila mag-aaway doon. Siguro mapapag-usapan nila yan at magkakaroon ng consensus. I think the important thing is develop the consensus, listen to the experts, and then come up with a unified uniform. In fact, this is not the first time that national and local were banging their heads on. A couple of weeks ago, pumunta kami sa Cebu just because of the issue between the way Cebu wants to implement border control and the way national wants it done. So, importante na very standard.
But then that creates now a problem because if Cebu was forced to follow the national standard or national mandate, then does it follow that the LGUs have to follow? Kasi if you listen to Harry Roque yesterday, medyo very adamant ang Malacanang na sundin ninyo yung instruction dahil bakunado na yung mga taong yan, no reason not to allow them. But of course, we know the science and reality on the ground is that in spite of vaccination, marami pa rin nagkakasakit. In fact, I just got a message from a friend in the United States in Westport, Connecticut. And alam mo yun, very exclusive area yun. Fully vaccinated, tinamaan pa rin ng COVID, loss of taste, loss of smell, fever, 1 linggo, at binigyan pa nung monoclonal something blood transfusion. Antibody para makarecover. Fully vaccinated at Pfizer pa yun. So, pagtatalunan yan, I suppose what also has to be clarified is whether it's RT-PCR plus vaccine card or vaccine card only. What has to be clarified, yung sinabi mong interzonal. Kasi ibig bang sabihin yan, kung gusto kong pumunta na kung saan, pwede na ako basta ma-produce ko yung RT-PCR at vaccine card. Kasi remember before, kung 65 and above, bawal bumiyahe. Dati, pag bata, bawal bumiyahe. Do you have any inputs on that, Doc Ted?
So parang ang ginawa nila, pinagsama nila yung, like for example, GCQ tayo sa NCR. Pupunta ka sa isang probinsya, magturista ka, at GCQ din doon, pwede ka nang pumunta, pakita mo lang vaccine card. I think that was the spirit of the initial IATF resolution. Pagka pupunta ka sa mas stricter, then you have to follow their quarantine rules. Kasi ibig sabihin nun, nag-i-implement sila ng stricter quarantine, baka MECQ sila or ECQ sila dahil mataas ang cases nila. So, pinoprotect nila yung community nila. So, yun yung intindi ko ng interzonal. Pero, hindi ito masyadong klaro, no? Hindi masyadong naintindihan. I've heard in other radio station, pinagtatawanan nila tong policy na to kasi nga, ano ba ibig sabihin ng interzonal? Hindi na-define maigi. So,
okay, parang parang yung panahon natin basketball, interzonal basketball league.
So,
Anyway, Doc Ted, last question na lang kasi I've run out of time. A quick answer lang. What is your response to the Israeli study that the Pfizer vaccine was not as effective against the Delta variant, and the decision or the movement of Singapore excluding Sinovac vaccinated individuals from their vaccination count. I mean, what is this saying?
Okay, so there are debate pa rin yan because the company says that the Pfizer vaccine is still effective against the Delta variant, although at a lower efficacy rate. But on the ground, the Israelis, who are about 70-80% of their population vaccinated with Pfizer, also got the Delta variant. Napasok sila. So yan ang background where they are. What is the truth? Somewhere in the middle siguro. So there is some efficacy, but it is not as high as what we want. So pwede ka talaga
What about Singapore?
Yung Singapore, I think Singapore is also talking from their own experience of Pfizer din kasi ang majority na ginagamit na.
Yeah, but yung ini-exclude nila, Sinovac in the count.
Oo, I think the Sinovac entered, it is not a government-issued vaccine. Kaya parang, I don't know how they entered that. Unlike us, tayo lahat is through the government. Even if you're private sector, dadaan ka sa gobyerno at yung EA. So hindi ko alam, hindi ko pa naaral yung detalya ng how Sinovac entered Singapore. Apparently, yung mga Chinese sa Singapore believe dun sa Sinovac. So
Okay.
Yun ang background. So now they're selling it there.
Okay.
So,
Well, thank you very much, Doc Ted, and nice to see you again. Hope to have a longer talk with you, and please take care and keep in touch.
thank you very much, Ito. Good morning to everyone.
Okay, that's Dr. Ted Herbosa, Special Advisor, National Task Force Against COVID-19. And I'm Cito Beltran, thanking you for joining us here on Agenda. Keep it on channels 8 and 250 of Cignal TV. We are One News.